Parents of adolescents often ask us, how can we really differentiate what's normal or typical for an adolescent versus what might be the signs of a mental health concern? I mean, this is a very common question, particularly during adolescence where there's so much happening, there's so many changes that are taking place. I think, again, the first thing here is you're looking for a significant change in mood, behavior, or thinking that's affecting one or more aspects of their life. So, for example, it's not having a bad test, but all marks that start spiraling downwards. Physical appearance may take a significant change. Sleeping patterns change normally during adolescence, but if your adolescent is really having trouble falling asleep, staying awake throughout the day, and again, for week on and week out, this could be the sign of something that's more significant. We see in terms of behavior towards others, probably the most significant one from a mood disorder side would be when they start to pull away from friends or pull away from activities that they previously enjoyed. In terms of the behavioral side of things, some risk-taking behavior is normal, is typical for adolescents. Actually, it's the adolescent that shows no risk-taking behavior at all that might be a sign of someone that's a little over-controlled. When the risk-taking behavior is not typical, is more frequent, occupying more and more of the young person's time, might be placing them or others at risk for self-harm or harm to others, that's really when you have to watch out that this might be beyond what would be typical for an adolescent. Probably the biggest warning sign is when friends start telling you that they're concerned about your son or daughter. They see your son or daughter probably more often than you do these days. They might be in the best position to notice a change in behavior, mood, and feelings, and they may have some real concerns about what might be going on. Similarly, they might be the best people to help bridge your son or daughter to appropriate services, even just to find out if they're okay.